They say her strength is louder than her fear. Breast cancer is one of the most talked about illnesses in the world, yet it's the most misunderstood. For many women all around the world, the word alone carries fear, uncertainty, and sometimes silence. In today's episode of They Say It Takes a Village, I'm joined with Dr. Tatiana Khoury, a highly respected breast interventional radiologist, to uncover truths, myths, and everything in between when it comes to breast cancer awareness. From screening controversies, emotional realities, this is a conversation that every woman needs to hear, every family needs to know, and everyone needs to be a part of. A quick moment before we kick off. Have you guys subscribed yet? If you haven't, can I ask for the biggest favor? If you could just tap that little button of subscribe wherever you're listening or watching this. It costs you nothing, but you don't understand how much it will mean to me. It keeps the lights on in this podcast and allows me to bring epic guests week after week. Think of it as your good deed for the week. And you don't even need to share the dessert with your kids. So before we get on to today's episode, if you could just hit that subscribe button, you do not understand how much it would mean to me. Thank you so much for your support. Let's get into it. Dr. Tatiana.
Yes.
Thank you and welcome to They Say It Takes a Village. I am so grateful that you're here today. I feel like this is a topic that only you can tackle. And honestly, I feel you're between your heart and your expertise, you've become really almost in the forefront of, in itself, I feel like you are the breast cancer awareness crusader, really. So I'm so grateful for your time, your effort, your energy to be here today. Thank you.
I'm really happy to hear that this is what you think about me, because really this is what I want to portray out there. This is what I want to convey to all these women, that I'm like you. Even if I'm a doctor, I deal with this every day. I have the same fears, I have the same anxiety from breast cancer too, because I deal with it every day. And we're here together to help each other, encourage each other, support each other to face it, and face not just breast cancer, anything that I believe like women, they have a lot of challenges. Any challenge that they might face, if I face it, I will try to teach them how to overcome this challenge.
Yeah. It's just, I feel, with this particular subject, it's whenever you talk about it, it's always in fear. There's never really any clarity. And I think for every woman who is listening, why do you think it is so is there parts of it that's misunderstood?
It's basically what you said, fear. Yeah. And fear controls us. And everything in life, we don't do a lot of things in our life because of fear. And because it's what we have heard about breast cancer. So if you hear the word cancer, you directly think of what?
Death.
Yes, but that's not the reality anymore. And breast cancer rarely kills women nowadays. So if it's caught early, the cure rate, how much do you think is the cure rate if it's caught early?
I have no idea.
Close to 100%.
Wow.
100%. So it's like any other disease that you have, you just overcome it and continue with your life. Yeah. In the past, we didn't have the technology to detect it that early. So yes, if you have breast cancer that is not detected, not treated, it will eventually lead to death. But this is not the reality anymore. Even advanced, let me just give you a bit of a hope, even advanced breast cancer does not kill anymore, because we have a lot of technology, we have a lot of different treatment modalities, that there's a lot of advancement out there. I just want to give this message of hope. I don't want you to be afraid, because the minute a woman is diagnosed with breast cancer at our clinic, she's just all over the place and thinking about death. And the first thing she tells me, I have kids, I don't want to die.
100%.
But I tell her, you will not die. The first thing I tell her, before I tell her anything about her cancer, I tell her this cancer will not kill you. It will not kill you. It's just a small phase. It's a small challenge. It's a small hill that you have to overcome, and you go back to your normal life. It's good that we caught it early, and that's it. It is as simple as that. Breast cancer does not equal death. Let's talk about breast cancer, okay? So the other cancers, there are so many different cancers that I'm not able to comment on each of them.
Of course.
Breast cancer in itself, the majority of the breast cancers are now easy to treat, easy to detect, and we can overcome them and they do not lead to death. This is the most important message I want to tell there. And this is why the fear will decrease, you know what I mean? And once you know information, once I convey what I know, like the cure rate is close to 100% if you catch it early on, then this will give you the incentive to go do your tests, you know, because you're afraid.
Of course.
I'm afraid to do a mammogram because part of it is I don't want to know if I have it.
I was going to say, you've got two people, you know, people who are listening, they're probably in two camps. One of them is very, very afraid, so therefore every test under the sun they would go ahead and do early. And then the
I have
other
these
ones,
two kinds of people that are so meticulous. Every 6 months, like even if the mammogram is done on October 1, the second year it has to be October 1.
And then there are other people, head in the sand, they would rather not know. And they think, you know, no, I don't want to. I'm too afraid. Ignorance is bliss. And then there's people in between.
But ignorance will affect you anyway. So let's say if you don't want to know if you have breast cancer and it grows, you're just giving it the chance to destroy you.
Yeah.
What you do is, with ignorance, you have fear, you have anxiety. How do you overcome them? When you take action.
Yep.
When you keep talking to yourself, I'm afraid, I'm anxious, I don't want to know. It's all in your head. You're not taking any action, so this will get worse and worse and worse. I always tell the patient, if you're anxious about something, take action. In life, even if
Face it.
Just take action. Do your mammogram. There might be nothing, and you might be reassured rather than living in this anxiety. And this vicious circle of anxiety is so bad that I see patients, it really destroys their daily life activities.
Absolutely.
They do not have a normal life. So either you have to face it, or if you keep on running away from it, sitting in the corner, it will just stay in your head. It will not do anything. It will not help in anything. It will make the anxiety worse and worse and worse. And that's why I have a lot of patients who come and they're like, oh, I'm so relieved. I did my mammogram and my ultrasound and it's negative. It's such a relief to know that, you know, that you can go ahead with your normal life, you know?
Dr. Tatiana, are you the first stop for people in terms of screening? So, I mean, for everyone who's listening, you are an interventional breast radiologist. What does that mean?
So basically, I am not the first stop because a patient should go through a clinical doctor. So I'm a radiologist. I read the images of the patients.
Okay.
I do the ultrasound. I read the mammogram. I see if there's a cancer or not, if there's other findings. But these patients, they should be examined clinically. I mean, the breast exam is important, and it's something that I don't do. There's a clinician that should see these patients before they come to me. They go through their family history, if they have family history of breast cancer, if they're feeling any abnormalities, any lumps, any pain, any changes, so that the next step, this clinician will order the adequate imaging that is recommended for this patient for her age. Because we can have a 25-year-old who's feeling a lump. We order an ultrasound. I don't go ahead with a mammogram. So there are different imaging for different ages and different findings. So they have to see a clinician first. Ideally, a breast specialist. Here we can see a GP, we can see a gynecologist so that they can refer them to us. And also for insurance approval, all of this, there's a big process. And once they get approved for their imaging, it is now I become like the second stop, where we do the imaging. And it is my role on the imaging that I recommend, whether I need something else or more, to decide if there's an abnormality or not. And based on that, we decide if we need to do further workup like biopsies, further imaging like MRIs, to see and make sure, because this is my role, to make sure that I'm not missing any early cancer on patients. So this is basically my responsibility every day. And when I think about it, it's just too much on my shoulders because every patient I see, I'm like, I have her life in my hands. If I miss something small, I don't want it to grow like for next year. So it's a big responsibility. And it is what it is. This is what I say. I do my best. I try my best to, this is what I have in my mind. This is a patient in front of me. I look at her and I consider her my mother, my sister, myself. She has kids, she has a family. We don't want anything to be missed that might affect her life dramatically.
Yeah.
And at the same time, we want to catch it as early as possible.
Absolutely. But that's what I mean. You go into it full of heart. It's not just a patient, it's a patient who's got an identity behind that. Yeah. And I think it's an incredible formula for patients to also feel a bit at ease. Like you said, it's one of these things that the word cancer just comes with so much fear, breast cancer in itself. I do have little statistics, and I wanted to get your opinion on. According to the WHO, in 2022, 23 million women, sorry, not 23, 2.3 million women were diagnosed with breast cancer. Of that, 670,000 lost their lives. What does that number, where are we then in this, given the fact that we've been, these numbers kind of are out in this world?
So it's a big number.
It is a big number.
And knowing, so when I tell women that breast cancer is common, so you cannot run away. As women, I tell them, just because you're a woman, you might have breast cancer in your life. And if I give you a number that is more shocking, it is 1 out of 8 women will have breast cancer through their lifetime. So if you're in a gathering with your friend and you're like... 1
out of 8?
Yeah, and it might be 1 out of 6 in certain regions of the world. So if you're in a gathering with your friends and you're like 10 on this table, most likely one of them will have breast cancer through her lifetime. So it's that common. And once you know that there's an enemy that is that common, and literally this enemy wants to take your life, then this is how we have this knowledge that it is common, I have to act upon it. Not it's common and I have to run away from it. So it is out there. And this death, the high number of death, we're talking about regions where they don't have access to medical facilities, where treatment is not good. So that's why these women are losing their lives.
Yeah.
And if we think about it, these women are women most likely in their 40s, in their 50s. These are at the peak of their career. They have kids that depend on them. They are important lives. So what can we do to not to get to this point is do our job as an individual woman, do what is your responsibility, leave the rest to whatever you are, the region, the facility, and do your screening tests. It is common. It is out there, And I'm sure you have a story of a couple of friends that 100%. Are at your age who have breast cancer, co-workers. In the past, we used to think about breast cancer. I used to think about my grandmother.
I was going to say.
My aunt who's
100%.
60. Now, it's different.
This is my next question, because for me, breast cancer was always associated with the older woman.
Yeah.
And now...
Unfortunately, now it's completely different.
Why?
The age group has shifted a bit, and now we're seeing more younger women getting affected. It is, I think, we really don't know why yet, but I think it's a matter of the lifestyle that we're living, the toxins that we are being exposed to at younger ages and at higher intensity than the old generation, the food. I believe that, the stress maybe that we're going through, so there's a lot of factors, a lot of risk factors that maybe are accumulating more. And of course, there's genetic changes that are happening that are causing this breast cancer to show at younger ages. So in the past, we rarely saw women, I'm talking 10 years ago, we rarely saw women maybe in their early 30s or in their 20s. Now, we see it. Late 20s, early 30s. Late 30s is becoming more and more common. So there is a shift in the dynamics of this cancer. It's targeting more younger women. And that's why we know that it's there. So we have to be more aware.
Absolutely.
And I tell women, even if they are in their early 20s and they feel something abnormal in their breast and they're not sure about it, go and get it checked. There is always exceptions. It's normal, most likely in the 40s and 50s, breast cancer will show. But we see it. So just know that it's there. It is very common. And there are exceptions. So always examine yourself and be aware of your body. Because as much as doctors know what they're doing, I trust the patient because she knows her body. I see her for 10, 15 minutes. She knows herself. If there's something wrong in her breast, she will know and she will come and get it checked. This is the message that is most important. Trust your gut. Trust your feeling on your body. You know it better than the doctor that is in front of you.
I wanted to ask you, in terms of with women, is there, because as you mentioned, obviously being a woman, you're likely the breast cancer, that's just
because you have a breast.
Because you have a breast.
No, that's it. If you are a woman with a breast, you're at risk.
So is there degrees of people that are at risk?
Yes.
So is there somebody low risk and somebody at very high risk?
So we are all at risk. So the general risk of the population is just because you're a woman. And there are a couple of risk factors and protective factors. What basically increases your risk dramatically is having family history. And not when I say family history because they will think, oh, my grandma, she was 90, she had breast cancer. We categorize also family history. It has to be the younger they are, less than 50. For example, if you have multiple maternal aunts, all below the age of 50, like 3 in their 30s and their 40s, this means that there might be a genetic thing going on.
Maternal aunt.
Both, from both sides.
Oh, okay.
Maternal and paternal. This is another misconception.
Okay.
So risk factor comes from the father and the mother. It's just that family history has to be specific, meaning that you have to have multiple family members or first-degree relatives like mother, sister, and the younger they are, the higher the risk. So you might have a mother that was diagnosed with breast cancer at 75. That puts you at risk, but it's different when you have a mother who was diagnosed at 42.
Got you.
And this is how we have each patient that comes to our clinic has a different risk stratification that we apply to her. So that's why what I said, she has to come see the clinician before she sees me because we go through the family history and we decide where does she stand with respect to the risk for the general population. The general population, we are all at risk. Some women have a higher risk, family history, genetic mutations, personal history of breast cancer, and then comes for the general population, risk factors and protective factors. And I always tell patients there's a lot of risk factors that come in. But if you have a risk factor, like you have a mother who has breast cancer, does it mean you will have breast cancer? No. So, because they're afraid, oh, I have risk factors a lot. You might have all the risk factors in the world and never get breast cancer. And you might have 0 risk factors with a lot of protective factors. Let's say, for example, breastfeeding is a protective factor against breast cancer. I can have a woman who has breastfed 5 children each for 2 years, and she still gets breast cancer. So it's a battle between the risk factors that you have, the protective factors, and some kind of thing that we really don't know what it is that ends up whether you will have breast cancer or luck. And I always say it's luck. Yeah. You know, you might have all the factors and never get it. And you might be 40, healthy, no family history, really living like the healthiest lifestyle, and you still get breast cancer. And this is where women ask me, why? I'm healthy.
That's what it is, right? Because you women, like you said, you know, we've always, and the thing is, I don't know if it's early detection or the fact that there is, as you mentioned, it's the lifestyle and everything is changing, that women are getting younger or being diagnosed younger.
At a younger age.
It's just because you get almost like you feel good. You're at your prime. 40 is very much, you've got all the energy.
Yeah.
Like you said, you're at the peak of whatever you're doing. You've got children that are growing up, so you're very, very involved. You almost get stopped in your track and you think, how did that happen?
Yeah.
I'm aware. I look after myself.
I'm healthy.
I do the right thing.
I exercise.
Yeah. And that, I think, more than anything else, is quite shocking to the system because you think, how did that happen? Where did that come from?
So here is where we have to change the mindset.
Yeah.
And we have to ask, not why me, it should be, why not me? Because it can happen to everyone. And this is what our brain doesn't really comprehend well, that not just breast cancer. We always see tragedies, you know, other people having an accident, cancer, and we always say it will never happen to us, right? This is what we all think.
Yeah.
It's something that is distant. No, once you change your way of thinking, like, you know what, this can happen to me, how can I do my best to prevent it? And here your best comes in what? In living healthy, exercising, doing everything that is right, you know, taking care of this body because it is important. This body will keep you going until, you know, till the end. So you have to take care of this body. I have to tell you that once I give this number to patients and they realize that even if they're healthy, so I'm going to ask you, if you are completely healthy and you are 40, you eat the healthiest, you exercise, you do everything that is right, how much do you think this will protect you from diseases and cancers? Let's say breast cancer, just breast cancer. You're healthy, you do everything right, you exercise, you watch your weight, you're doing it right, you're perfect. how much do you think the percentage of it protecting you from breast cancer would it reach? 30, 70, 90?
Yeah, high percentage that it would protect you.
Maximum 30%. If you're doing it all right. If you are like perfect, 30% is the protection that you get from being healthy, from watching your weight, from exercising, from doing everything right. There's 70% that is out of your control, literally. So is this scary?
Yeah.
Yes. Can we control it? No, it's out of my control. Let me control what I can do. Living healthy is important. Why? Because if you get any disease, including breast cancer, your body will have enough immunity and it will take you through the treatment faster, you will heal faster, and you will go back to your normal faster. This is how you want to think, okay? So you're healthy.
Have faith in your body that if there's a bump in the road, get the treatment, but have faith in your body that your body will get you there
because
over to the other side.
Because you took care of this body.
Yeah.
You took care of this body well enough for whenever there's a bump, it will overcome it. Of course, if you are not taking care of this body, any bump will make you fall deeper and deeper into the hole. But if you have a good body, good immunity, it will literally take you through the storm. You will overcome the storm, okay? So it's a very nice example I use every time. There is a hurricane in the sea, and either you have a big luxurious yacht or you have a small broken wooden boat. So this is how our body, if you don't take care of this body, this wooden boat, the hurricane will destroy it. And it will take a long time for you to build it again. But if you have a big boat that can go through this hurricane, it might go up and down. It will go through it. So this is how we have to think about it. You have to change your mindset. If you're healthy, it doesn't mean you will not get any diseases. Because this is what people think, and this is what they tell me. Why me? And the question here is, why not me? Why this should not happen to me? And this is when you will be more humble in accepting life's challenges and problems that we all have. And it's not always other people that will have the diseases and the traumas and the accidents in their life and the tragedies. No, things can happen to your family, to you, And when you change this mindset, whatever comes your way, you become more accepting, more humble that, at the end of the day, this is the capacity of my body and I cannot control it. And we get a lot of this from people who have chronic diseases. They realize that they don't ask themselves the question, why me? They ask, how can I overcome it? It's just moving forward. Any problem, any obstacle that you have, just get it over, and take care of this body. And that's why we always advocate self-care. What is self-care? Taking care of this body, In case you have something, you will overcome it. That's it.
It is definitely a change in mindset.
You have to change your mindset, especially when you grow older. When you're in your 20s...
You're not even thinking about it.
Exactly. In your 30s, you're trying to find yourself. But I believe, when I was 40, when I hit 40, it was eye-opener that I have to take care of this body. It's going to be there for another good 30, 40 years. So, I exercise, I increase my muscle mass, I eat healthy, I make choices that are good for my mental well-being too. It's not just the body, it's your mental well-being.
Absolutely.
In the past, these were
get on with it. Just get on with it. Take the stress, take the hits to your body, to your health.
And now it's a completely different mindset. Everything in life is a mindset. And changing this way you look at diseases, you look at health, you look at your body is important.
But I love the fact that it's not so much prevention, right? So you're not saying live a healthy life to prevent these.
No, you cannot do it.
That's right.
I'm telling you.
Live that healthy life to equip your body to get over these fairly quick.
Exactly.
Or not fairly quick, but a lot easier than if you were having to, or, in a situation where you're not at your best.
Immunity is like an armor.
Yeah.
Okay, so you're putting additional armor on you so that you can overcome a battle that is coming. If you have zero armor, you will probably not overcome it. Your immunity should be taken care of, your weight, your exercise, your muscle mass, all.
It's true, because you're sort of in preparation. Should anything happen,
Exactly.
I can manage.
Why are you doing this then?
Yeah.
I would sit on the couch all day.
It's funny because, 5 minutes ago, I would be thinking, no, I'm healthy to prevent.
No.
Yeah.
You're healthy to prepare yourself for a battle.
Correct.
That's
it's definitely a change in mindset. And I think that in itself is the perfect way to almost summarize this episode, because you can't control it.
No.
Like you said, you're a woman, you have a risk of breast cancer. That's
That's
it. So, but the fact that we're not saying, I might as well just, I had a question about prevention. It's not about the prevention, right?
The prevention is doing do your responsibility, like do what is your part. Be healthy, do your checks. Do not miss your checkups.
So this is my question. Sorry
to interrupt. This is part of prevention.
Yeah. My question is, like the technicality of it. Where do we start? Do we start with self-examination? And if we feel something, is there such a thing that you don't feel anything, but you still go and get a mammogram?
Yes, at 40.
Okay.
At 40, regardless. That's why they're called screening tests. Screening means you want to catch something when the patient doesn't feel anything.
Okay.
And there are a few screening tests, by the way, and we're lucky to have them. Mammogram is for breast cancer. Pap smears are for cervical cancer. Colonoscopy for colon cancer. And there's also for prostate cancer, the PSA, which is a blood test. And there are ages where you need to start these as a screening, meaning you don't feel anything. And this is the whole point of mammograms. Mammograms, I want a woman in her 40, healthy, no family history, to come do a mammogram, because on the mammogram, I can catch the cancer that is 5 millimeter.
Okay.
Instead of her coming at 43 or 42, feeling a lump, the mass has grown, it has spread to the armpit or to the other parts of the body. That's the exact meaning of screening and prevention. Prevention is by early detection, but not prevention by preventing the cancer all in all. You cannot prevent it. It's not in your hands. So this is where we also need to change another mindset shift, where I cannot prevent cancer, but if I have cancer, I want to catch it as early as possible. This is where you will give me a chance. When you come, you're not feeling anything at 40, which is the recommended age, do your mammogram and do the additional imaging that we might want to catch any small cancers that is 5 millimeter, 1 centimeter. And this is literally saving lives, saving a life.
Okay. You have people that are sort of more contradictory at the moment. I was having a quick look online. And they're probably not professionals, and I'm getting the opinion.
I want this opinion because I hear it every day.
About the mammogram and the radiation.
And this affects women a lot. And this is one of the things that we don't want out there.
Yeah.
You know?
So this is it, because there's even, conversations within my circle,
Yeah, of course. Radiation is something that...
The radiation, are we exposing unnecessarily if the family history is low or whatever it is? Is there a situation where the mammogram could cause a cancer?
Okay. So let's go back to the basics.
Okay.
A mammogram is an X-ray of the breast. Okay, so there is a certain amount of radiation. However, the dose that we expose the breast to is really low, and there are international committees that make sure that these machines, the radiation that they're emitting is low. I go back again to one thing. Everything has risks and benefits, from the small Tylenol tab that you take to the mammogram. The Tylenol tab that you take, if you read the precautions, it causes liver damage and there's a lot of things. Why do you take it? Because the benefit of taking it now to relieve fever or headache is more than the risks that it has. With the mammogram, again, so mammogram has a small amount of radiation. Are we exposed to other radiation similar to the mammogram? Yes. When I travel inside the plane, there is radiation that is similar to what I get exposed in a mammogram. During our everyday life, so we tend to focus on one radiation and we forget what we are being exposed to every day. During our everyday life, we are already being exposed to radiation. From the sand, the mountains, there is background radiation. So I'm going to give you an example. One flight from here to Europe is equal to 1 mammogram. In the plane, there is a radiation that we get exposed to. 3 months of useless background radiation is similar to 1 mammogram. But what we decide to cancel, something that might save my life. Do I cancel a vacation because I might get exposed to radiation to Europe? No, it's a vacation. It's
Never.
But do I cancel a mammogram that might save my life?
Yeah.
Yes. Let's take it the other way around. So let's say the radiations might be inducing cancer. Might. And everything might happen. There are exceptions. What is let's give numbers. What is the percentage of or the proportion of women that will be diagnosed with breast cancer from being overexposed to radiation and mammograms. I'm going to give a rough number. I think it's not, but just for the to get the idea there. I'm going to say like 1 out of 100,000 women might get breast cancer from the mammogram.
Okay.
How common is breast cancer? 1 out of 8. Okay? So it's an enemy there. I cannot run from it by using this excuse that I might get breast cancer from the mammogram. It's already there and it's very common. I have to make sure that I'm doing the right things to catch it as early as possible. And why mammograms are important? Because some patients tell me, you know what, okay, I want to avoid the radiation of the mammogram, and she's 42, for example. Let me just do the breast ultrasound, which is the exam that I do. So I tell her, regardless, before I even start the ultrasound, I tell her, regardless, I might miss something on the ultrasound that I only see on the mammogram. Because the ultrasound will catch masses. So when the mass forms, it's a lump. So I can catch it on the ultrasound. What the mammogram is good at, it catches things before they are lumps, before they are masses. And these are called calcifications. Literally, calcifications are like the small salt grains that we see on our food. They're that faint. I can see them on a high-resolution mammogram, and they are a precursor of cancer. So if I remove them in that stage, I would be literally saving a woman's life before it's a lump again. So there is risks and benefits to everything in life. We have to accept that there is a risk because the benefit is a woman's life.
Yeah.
So I don't think anything compares to a woman's life, okay? And this is how it's a mindset at everything that we see. A mammogram has some risks, but the risks are really minimal. When I'm telling you I'm saving the life of a 40-year-old who has 3 kids that depend on her. So do I need to talk about the risk anymore? Do I need people who, with this background noise that are making women so uncertain of their medical choices that why would I believe there's a lot of people out there who are health advocates, but you have to be careful on what you go on social media and say, because this is deferring women from doing their mammograms. This is like dangerous. It's dangerous to go out and say that. You should only get this information from the medical healthcare providers that you have. Do a research, get the numbers, and I tell you, ask ChatGPT, what is the risk of getting cancer from a mammogram, and what is the risk of getting breast cancer all in all? So, you know.
Compare it. Yeah, compare it. Use the logic. Speak to somebody who is, in that community. Don't, like you said, just...
And I get a lot of women who come and tell me, I don't want to do the mammogram. I tell her, it's your choice, but let me give you the right information. Because if you don't have a good base of knowledge, you will not know how to take this decision about a mammogram or not.
Of course.
And after I tell her this, she's like, oh, okay, I didn't know that. Let me do the mammogram. So the mammogram is important. Do not miss it because of, a lot of people, there's a lot of health advocates out there that I believe are doing the wrong thing. They are just confusing women. We don't want to confuse women. We're really out there to help, to put the right information out there. The medical information is out there. And this is based on a lot of studies. If we don't do the mammogram, for all these health advocates, do we have an alternative? No. So we're pushing something that is there, and we don't have. So I ask them, what is the alternative? Yeah. Do an ultrasound. Okay, on the ultrasound, I might miss also things. So we're not doing it right, So until now, unfortunately, this is the only thing that I have. Yeah. This is my gold standard. The mammogram is the gold standard. This is my only weapon to fight breast cancer now. Once I have alternatives, I will use them, But now, don't come say incorrect information without an alternative. Because you're making women confused, and there's a certain percentage of these women who have breast cancer that it will grow and they will lose their life. How did you help them in that? I don't understand. How did you help them? You just confused them.
It's true, and it's actually quite sad because you do have a lot of people, and they will say, "Oh, so and so said," and then they really
and ask them, who said?
Yeah, and then that would really become a point of sort of doubt whenever they go in. And I mean, to be honest, even me myself.
Of course, we're all going to have this doubt.
This doubt.
Yeah.
I've just turned 40. I haven't booked a mammogram yet. I have to, and I know I have to. But obviously there's that sound in the back of my
And
mind.
if I say all the women that are in your age are thinking like that, what is the percentage of women will come forward and do it?
Yeah.
It should be the other way around. It should be the majority of the women who are in their 40s, they should come forward and do their mammogram regardless. But when you have a lot of these background noise, incorrect information on social media, not just with breast cancer, there's a lot of incorrect
With
information
everything.
about everything.
There's conflicting
nutrition,
information. Yeah.
supplements,
Yeah.
exercise, and you have to be very careful. I really think there should be an authority that sees what is the information that is out there, because everyone now who has a camera and a phone and an Instagram account or a TikTok or whatever, the TikTok is even worse, they come give information that is wrong. And I don't blame these people for trusting them.
Yeah.
You know, this is what you see every day. You don't see a doctor that often.
100%.
So you will trust them. Because once you see the doctor, he will give you the right information out there. And that's why I really want to say that more doctors should come out. More doctors should come and talk the correct information. But it is what it is out there. And we really have to be very careful what to believe.
I think that's what it is. So now let's say for the woman who's listening today and watching, you turn 40. What would be your first step?
Turn 40?
Yep.
You have to think about your mammogram. You
Okay.
have to do your mammogram.
I know.
So you have to be...
It's like you're talking to me.
So you have to go
100%.
see your GP or
Okay.
your gynecologist or a specific breast specialist to examine your breast. Go through your family history because it's personalized. Each woman is different from the other. And this is how we treat women at our clinic, with her family history. And then we take it from there. We order the mammogram. I look at the mammogram. I decide if this patient needs additional imaging like an ultrasound, because it can be added to detect more abnormalities.
Yep.
And if you do your mammogram and ultrasound and everything is normal for this year,
So
you're done.
do you repeat it year after year?
Yes.
Once
That's what
a
I
year.
said. So for this year, you're okay. And I tell the woman, and there's a lot of challenges that we face with breast. So not all women have what we call easy breast to detect breast cancer on. It depends on the type of breast that she has. We have what we call a dense breast. So if you have a dense breast, it means you have a lot of tissue in your breast. So a mammogram of a woman with a dense breast is like a sky that is cloudy. So if a tiny bird passes, I might miss it, which is the cancer. So I might miss it. Versus there are women who are lucky who have a not dense breast. They have a fatty breast. This is what we call it. And it's similar to a clear sky. So any tiny butterfly that passes, you will find it. So there are challenges even with the mammogram. And this is what you have to know, that even if you do your mammogram and ultrasound, I write it in my report, there's a 10% chance of a false negative. It varies, of course. It's not always 10. But there's always a chance that there's a false negative in there that I didn't detect for some reason because of the challenges. So I tell the woman, the guidelines say you have to do it every year. Today, you're okay. I didn't see anything. In a year's time, you have to repeat it. Just in case something develops from this year to this year, I will catch it as early as possible and increase your cure rate. And just in case there was something that was missed that is really millimetric that we could not see today, I will catch it next year. And it's still early because most of cancers, they need a year and a half to double. So it's still small. Whatever I might miss here, I will catch it the next year. So because some women, they do their mammogram and ultrasound at 40 and they come back at 45, which is wrong, okay? If you do not do it regularly, meaning every year, if you want to do it every year and a half, every 2 years, I will give you this permission, but do it regularly. And I tell them, put it on your phone calendar because you're a busy mother, you're working, you're going to miss
you
like a year will pass.
deprioritize yourself. Yeah.
And this is important. You have to put it on a calendar. This is the day where I need to do my mammogram on a yearly basis. It's just part of many tests that you need to do. It's not just the mammogram. And this is what I tell women out there. Do your regular checkups, your blood tests, thyroid, insulin, blood pressure, heart exams, everything, including the mammogram. So it should be also a mindset. This is how I take care of myself. I go to the gym, I eat healthy. If I don't do my checkups, there might be something that, they're missing. So everything caught early. Every disease, not just breast cancer, diabetes, hypertension, heart diseases, when they're caught early, you give us a chance as doctors to treat it and make you overcome it.
Okay. 40. It's, my other question is there a point where you stop doing mammograms? Let's say you're good until you're 60.
So the guidelines say 40 till 75. I'm following the American guidelines.
Okay.
And I believe this is what I follow, because in Europe, they're a bit different. In the UK, they're a bit different because they're governed by the healthcare providers, which is the government. So I'm going to say that there are certain countries like the UK, they don't start screening until the age of 50.
Okay.
Because it's more cost, they have like a large population of women. We're talking about 8 million maybe.
That's right.
I'm not sure.
Yeah.
But it's not cost effective for them to start screening at 40. What happens to these women below the age of 50? If they are diagnosed with breast cancer,
They become part of a
it's
statistic.
cheaper to treat them than to do this regular screening year after year starting the age of 40. Okay, so not all the guidelines that you hear are for your own benefit. So sometimes we might doubt the government's, the healthcare system, how it works, because it's not always for our benefit as an individual. So for them, healthcare authority thinks about how it is cost effective for the government because they're paying for everything.
That's right.
But are they thinking about this woman who they did not include in the age group that gets diagnosed with breast cancer, how her life is affected, how she might not overcome it, how her whole family is affected, her children, her life, her career? We're not talking about numbers. We're talking about valuable human
Life.
beings. Okay, and there's a big dilemma about that, of course. We cannot go into this. But know what is out there. I get a lot of women who come from the UK to Dubai. They do their screening tests here because they're allowed, or now they pay for it because the government will not cover it. So the women are more aware, but I need them to be more aware and take action about it. Do your screening test as early as possible. And there's a lot of numbers, 45, 42, every 2 years. I follow the American guidelines if you want to read about them. 40 yearly. It is very common, the breast cancer. If I have it, I want to catch it early on. If I don't have it this year, and God forbid it develops through this year, I want the doctor to catch it also as early as possible next year. And I also tell them, during this time, which is 1 year, if you feel anything is abnormal, please do not say, I did my mammogram and it's normal.
Yeah.
Come back. And every patient, I tell her that. All my patients know it. Anything that you feel is abnormal in your breast, anything, skin, tiny pimple, how silly it is, come and get it checked. And this is how you're doing your job with the prevention part. And the prevention meaning not preventing the cancer, but early detection. And this is how we say it. Prevention with breast cancer is early detection. Yeah. In a nutshell.
One thing that I sometimes read, and again, in preparation to this, I was reading a lot about your ethnicity and breast cancer occurrence. Some ethnicities have a higher chance of getting, the likelihood of breast cancer versus others. Is that something that you take in consideration in terms of risk factors?
Yes. This is one of the things that we took into consideration. There are a lot of ethnic groups who are at higher risk. African American women, even if I go like certain regions, they have a higher risk. It's probably related to genetic predisposition. Yeah. There's also the Ashkenazi Jews, they have a lot of risk. These are treated differently, because they're at a higher risk. But yeah, it depends a lot. This is genetic predisposition, and this is something that we cannot control, so we have to accept it as much as we cannot control the density of our breast, because women tell me, why is my breast challenging? This is the way you are. It's like asking me, how can I change the color of my eyes? This is what you have inherited from your family. We inherit the good things and the bad things.
That's true.
We like the good things, but the bad thing, what? We accept it. It's a whole. It's like you have to really love yourself. Absolutely. With the good and the bad, with the nice and the genetic predispositions, the dense breast.
Yeah.
I tell them accept it, just overcome it by doing your checks regularly. And these women who have high risk, we take into consideration their ethnicity, of course.
Quick question, just on the genetics before I move on to something else. But with the genetics, are there things that you can do like blood tests and things that are giving you an understanding of your risk category?
Blood tests now, so let me tell you, there are like cancer cells that are roaming in our body, and our immunity kills these cancer cells.
Okay.
There are new things that are coming out where we do a blood test and we go through if there are cancer cells that are, but this is still very new in research, not very well established. So now, is there a blood test that if it's positive, it means that you have cancer, breast cancer in specific? No. And not just these blood tests that go into the genetics, it's the tests that do the markers, for example. There are certain markers, blood markers that are we call them tumor markers, associated with certain cancers. For example, CA125. If you do a blood test for these markers and it's high, does it mean that you have breast cancer? No, it's not specific and not sensitive. So I get a lot of women who have a high blood test. They tell me, I have breast cancer, and I do the imaging, there is nothing. Really, the imaging is what we need to follow. Currently now, to say that there is a test that tells me you have breast cancer, now, at this moment, no. But it's in the research, and there is also a lot of research going on giving vaccines for cancer. These vaccines will be killing these roaming cancer cells that are in our body and prevent cancers. Is it something we do now? No, but in the near future, I think, there's a lot of things that will be evolving. And maybe breast cancer and cancer all in all will be a disease that we'll be talking about in the past. But that's the hope that we have.
That is the hope.
You know?
Yeah,
I think we will reach it, but there will always be new diseases, new things, new challenges. This is a humanity.
Absolutely.
You know, there's always a disease, a challenge, something that we have to deal with regarding our health.
Yeah. I think what's good about it is, of course, you read about the research and things like that, but it's almost like a bird in hand, right? The imaging is what you're having a look.
This is what we have now.
What you have now.
Yeah.
So don't almost, sit and wait for things to happen.
Or look for alternatives that are not scientifically based and are not good.
Or not even approved yet, or not even, nothing that is going to be something.
I get a lot of patients who tell me they do the thermography of the breast. It's this one of these methods where they detect breast cancer based on the heat. It is not approved. It is not scientific. It is not based on any data. So I cannot tell you if you have a negative thermography scan that you don't have breast cancer, or a positive. So there's no data, and as healthcare providers, if I don't have data, I can give you my expert opinion, but I cannot give you an answer, 100% answer.
I have to ask this because I think there's a lot of conversations around now about things that we're putting on our skin, whether it's things that are clean products, deodorants, body lotions, these things that are causing, they're calling it hormone disruptors or endocrine disruptors, whatever they might be. Is there, in your opinion, a really big link with non-clean beauty products and that industry? Have you seen a link to potential breast cancer?
There is no link. There is no link that is scientific based on studies. Yeah. This is how I can give you. My expert opinion might be different. Are they affecting us indirectly in a long-term process? Is it a long-term process that is indirectly affecting our body in minimal, doses every time? I think yes. Can I say yes? No. But what I can do is try to look for products that have less toxins, less aluminum, less paraben, less these silicone, toxins, even in the makeup that we put. Yeah. And I know sometimes that this makeup might not be the healthiest, but I put it, there's no alternative now.
It's like the deodorants. It's always, you look for those alternatives. And, it's
just that we do not know all the ingredients. And if they tell us all the ingredients, you might not use it all in all. What I try to do, for example, the antiperspirants for the armpits, I shy away from ones that have aluminum and parabens and alcohol. So I use one that is more natural. Yeah. It makes me feel better.
It makes you feel better. That's it. Yeah.
With the perfumes also that we use, I try to put it on my clothes rather than on my skin, so that it doesn't get so much absorbed. There are probably hormone disruptors in it, I'm sure, but what is the percentage that they're affecting really? I don't know, because there are no studies that are going to be coming out against these big, makeup companies, I think with time there will be more regulatory regulations about what is really inside these, and not just say fragrance, you know? Because if you look at the very expensive perfume bottle, there's fragrance, and you don't know exactly what it is.
What exactly it is.
Yeah,
and
so
that's it.
With time, I think we will be more transparent with what is exactly in, and decrease the preservatives that is in food, for example. Now we're more aware of these preservatives. We used to eat without knowing.
The foods, even the pans, you know, the pans that have all of
the
these,
non-stick
the
pans,
non-stick,
the plastics, the microplastics,
That's right.
the chewing gum that we eat has a lot of plastics. So it's really not our fault, but we have to be aware that the more we not use these products, the more we are aware. It might take a lot of effort from us, especially with our kids, because our kids are exposed to a lot of sugar, I don't know, preservatives, chemicals in this food and everything, you know, from the toothpaste to the lotion to the shampoo. So how can you control all of this? I really don't know. And it takes a lot of effort. And if you're a working mother with 2 kids, I don't know how we can do it. You know, there are people who are specialized in this, and they have a lot of time to do the research.
Absolutely.
And they have also the available alternative. You might live in a place where you don't have the alternative. So
you don't have, and like you said, I mean, at the end of the day, life must go on. As a mother who's working, who's got 2 kids, you need to wash their hair, you need to, you know, things like that. What is the alternative?
Even with the food, like, do you get everything organic? How confident are you at this is organic? You're paying triple the price and you're not really sure. Like, for example, I try with the chicken. I don't do a lot of chicken if I don't know. I try to get them hormone-free, organic. I try my best.
You try your best.
You try your best. Is it enough?
But I feel like that
not.
It goes back to what you were saying right at the start. You know, at the end of the day, 30% is in your control. 70 is not in your control.
Yeah. But this 30 is decreasing because it's also not in my control. This is what the market is. And this is what they're feeding us. This is what they're giving us as product. It's not like someone really cares. There's a lot of people who are coming with more organic. Maybe we should shift in our mindset as a market, as, you know, everything into this more organic, less chemicals, less damage to our... At the end of the day, our cells and our genes are also affected by these.
Absolutely.
Our hormones, our genes... and I'm not afraid about us. Maybe we're less exposed than our kids.
Yeah.
I'm afraid about my kids. What are the diseases that they will have? Is it always, it's only going to be cancer, or there will be other things, you know? And I tell you again, cancer means death, and most of the time, there are worse diseases than cancer. There are autoimmune diseases.
I was going to say the ones that
chronic
you live
autoimmune
with.
diseases, which are related to antigens that we are exposed from the outside that our body is fighting against. So not everything is cancer. And that's why I have, for example, a lot of women who are anxious. My mother had breast cancer, and she comes to her mammogram ultrasound. She's so anxious. She cannot continue with her life. She's just waiting for this. And I tell her, you know what? You're worried about breast cancer. You know that there are a lot of diseases out there that are worse. And if you cannot control it, just let it go, because it's not in your control. You're affecting your whole life over something that you cannot control. God forbid you can go out of here, have a car accident. You lived all your life in anxiety for something that might not have happened to you.
Absolutely.
And you might get something even worse. There's a lot of diseases out there that are, from my point of view, really worse than cancer or breast cancer. Breast cancer, we can treat it. There are diseases that we cannot treat. This is the thing that we should worry about.
Speaking of treatment, breast cancer and chemotherapy. I mean, that's the 2 things that you will always hear.
Yeah, we always worry about chemotherapy.
Right.
About hair loss. That right away.
The hair loss. You see, obviously, the hair loss that goes with it. The general feeling of complete sickness. You know, that person really does feel awful at the time of treatment. But as I understood after reading a little bit of it, doesn't always necessarily have to be that way.
No.
There's a lot of treatment options.
Yeah. So with breast cancer, it's not one treatment.
Yeah.
It's also personalized for every patient and the type of cancer. It's a big umbrella of breast cancer, but there are different types, and each type is treated differently. There are certain cancers who do surgery and radiotherapy only, no chemotherapy. There are certain that do not take chemotherapy, they take hormonal. So there is this percentage of women that take the chemotherapy. And in the chemotherapy, there are a lot of different types. And not everything might lead to hair loss. And there are also things that might reduce the hair loss. That's what we call the cold cap.
Yeah.
So there are things that are, you know, hopeful. I'm not saying chemotherapy is an easy journey. It's not. I'm happy that a lot of patients are sharing their chemotherapy journeys on social media. This is important to know that, okay, you're sick during that period. It's a transition to the new you. And I tell women that with breast cancer, it's not easy because it affects our most feminine parts, our breast. It's so feminine. I tell a woman, okay, I see surgeons tell them, "Oh, just remove your breast, we'll put another one." It's not easy. It represents our femininity.
Absolutely.
Our hair is for me, if I have trouble with my hair and I do something and my hair is not doing well, I'm depressed.
To be honest, I recently cut my hair and I don't love it.
Yeah,
and
yeah.
Honestly, it's affected me personally.
Me too, and me too. I cut my hair and it was a bit damaged at the ends. I was like, I'm using all type of products to make it look better. So I can imagine women who are losing their source of femininity. It's a very important part of us. But also you have to change the mindset. It's a small bump that will take you to the new you. I can lose a breast, I can lose my hair if I keep my life, if I save my life, and I can continue as a mother next to my children. So there are you have to prioritize.
Absolutely.
When you're facing cancer, you have to prioritize. But not all cancers will lead to hair loss. Yeah. And there's a lot of new treatments. There's targeted therapy. There is immunotherapy. So it's not always chemotherapy with hair loss, what we see, and the vomiting. The side effects are much less now, and each woman is different in how the side effects are. Yeah. So it's very versatile. Not because I get women, I tell you, they do surgery and only radiation, no chemotherapy. So you can be one of these women. Yeah. So it's not always chemotherapy.
And I think that's what it is. It's the fear of what you see looks quite difficult to go through. But like you said, you're seeing the tip of the iceberg. There's so much other options. There's so many other ways to potentially treat it. But you won't know until you actually go get checked.
Exactly. And you don't want to delay your checkups because you're delaying us catching this cancer.
And giving you more options.
So these chemotherapy and these treatment options become less and less if you are at an early stage. This is how you should think about it. Yeah. So if you don't want to go through a lot of chemotherapy, really we have to catch it early on, because these cases that you're talking about are the advanced cases where we have to really use the hard chemotherapy. That is what causes all of this changes.
Side effects, yeah.
Yeah, and go through stories. So whenever a patient is diagnosed with breast cancer, I always give her the contact of another patient that went through it, because it makes it easier to know that it is not as bad. Our idea of chemotherapy is what we see in the movies, It's, the bold, thin, pale, sick. It is not always like that. And I encourage you to follow people who go through chemotherapy. They continue with their lives. They are able to overcome it. And you get your life back, and you're on track back, and you continue. It's a small period of time. This is how it is. This is how we think about it. And this is what I tell patients. When they're diagnosed this year, I tell her next year, you're going to be here. You're going to be cured. You're going to be on with your life. And this was a small, short period that brought the new you back in.
It's such a beautiful, hopeful message, honestly.
It is. This is what it is. This is how I try to tell patients about what to expect. They will come back. This will not kill them. And they will have it's a new you that will be there.
A new perspective also. You will have a new lease on life. This new perspective when you're not really, you've gone through such a big hill and you've come out the other end.
Of course, there's a lot of anxiety, fear that comes with it. We're human beings. We want to maximize our happiness, decrease our pain, our tragedies. It's normal. But once you have it in front of you, there is nothing that you can do other than to face it. Just grab all the power that you have and face it. And just be, especially with doing your test. If you have a fear of doing your mammogram, get a friend with you that might encourage you. Don't do it by yourself. Read more, talk to the physician, let them give you more insight about it. Just don't let fear, anxiety overcome you. And you sit in the corner living in this vicious circle. Once you take action, it becomes so much easier. Just communicate what you're thinking of. We will help you. So there's a lot of fear from the doctors, from the hospitals. No, it's changed. There's a lot of people out there who understand your anxiety. I feel the same. I relate with every woman who comes, So just talk, communicate, tell us what you're feeling. We're there to help you. doctors are not the enemies of patients. We're there to help you. We're not there to torture you, you know, and we can make it easier for you. This is how it should be. If you don't like this doctor, they're mean, they didn't listen to you, find another doctor. Don't stop going all in all to the hospital because this doctor doesn't...
you didn't vibe. You didn't vibe with that person.
Find a doctor that you vibe with.
True.
It's as simple as that, you know.
Yeah.
Find a doctor. There's a lot of doctors, a lot of hospitals. And consider yourself lucky to be able to get to a medical facility. If you have medical insurance, you're lucky.
Absolutely.
Understand, you should feel gratitude every day. You are in a, let's say in Dubai, you are in a country that provides insurance. You are able to see a doctor as soon as possible. You're able to do everything. So you are lucky.
Amen.
Let's talk about the underprivileged women who are diagnosed with breast cancer. They cannot be diagnosed by imaging. They cannot be treated. And they're losing their lives just because they don't have access to healthcare facilities. So think about it this way. Really, you will change how you look at your own checkups. You will be like more than happy to go do that.
Absolutely. You feel like you said grateful and privileged.
You are privileged. Most of the women don't know how privileged they are. So make use of it. Why do you pay for medical insurance if you don't go to see the doctor, if you don't go do your checkups, if you don't do your mammogram? What is it, for an accident? You prevent the accident, you know. 100%. It's not just a car accident that you need to go to the ER to. There are other accidents that you need to prevent.
I'm 100% with you. I think it's just, but again, you break it down so not intimidating. You know, the way, you know, it's very matter of fact. This is what it is. Like you said, it's cancer does not equal death.
Exactly.
You know, take advantage of the fact that we live in an incredible part of the world where we have access to incredible professionals.
Exactly.
You know, state-of-the-art imaging platforms. Yeah. So it's just why. It's the fear. It's the fear. Overcome the fear. Hopefully the person who's listening to this is going
the fear and communicate it. What are you afraid of? I can help you. Are you afraid of the radiation? I'll explain the radiation.
Yeah.
Are you afraid of the pain in the mammogram? I can also explain that it's not painful. We can talk to the technician to be more, to treat you differently. You know, there's a lot of just communicate. You know, just communicate with us. In the hospital, we are not your enemies. We are here to facilitate your journey, to make you healthy. You know, we are not here to torture you, do blood tests, do unnecessary procedures. You know, we do what is necessary, and this is what we know to help you better. It's not about, you know, the hospital doctors are not, you know, fear. They should be a place you come to comfort yourself.
Absolutely.
You know,
absolutely.
This is how you should. If you don't like this hospital, there's a million. Change it. This they didn't treat you well. Choose a different doctor. You know, go back home where you feel more comfortable, maybe with your doctors. But do not stop all in all going to the hospital and doing your checkups just because the person in front of you was mean. Because I get a lot of it. The doctor didn't listen to me. They didn't understand my fears, my concerns. Find someone else. Yeah. But take care of yourself.
Absolutely.
You know, it's your responsibility to take care of this body.
Yeah.
And I tell women that have children that they forget, you know, I always say, why didn't you come for your mammogram? Oh, I'm busy. Your kids will not push you to do your mammogram or your checkup.
Your husband will not.
No, because you are responsible basically for their health.
Yeah.
As women, we take care of everyone else. Our mother, our kids, our husband's health. And at the end of the day, I ask her, did you do your checkups? It's like, oh, no, I'm too busy. No, you're not too busy. Because if you don't take care of yourself, of your body, no one will. And once you're sick, maybe this whole circle will fall apart. Then you really need to take care of the pillar of this house by doing your checkups, by exercising. And for example, like exercise is my priority. Even sometimes I might miss some time with my kids, but I tell them, I'm exercising. Mom, come play with us. Come read the book. I tell them, really, I'm doing this because I want to be healthy for you guys.
Absolutely.
And this is, when you educate your children about that, they will see you exercising. They will see you prioritizing yourself as a mother. They will learn that this is good for themselves and therefore wives in the future, because I have 2 boys. So
do I. It's the same.
So, you know, you don't want them also to have a wife in the future that is not prioritizing herself because she's another woman with her risks. So it is a matter of mindset, prioritizing, knowing what is good for you, not listening to incorrect information out there in the social media. And I get a lot of patients who send me these reels. Is this correct? Is this true? The last one was, doctor, did you know that mammograms were banned in Switzerland? I was like, Really? I asked ChatGPT. I went into Google. Did they? Maybe I wasn't sure. It's like there is no evidence of this was being banned. You know, there's a lot of rumors out there. Do not believe them.
Yeah.
Ask the healthcare provider. How true
Absolutely.
is it? Because if I tell you, you know what, mammograms were banned in Switzerland, and then say, oh, maybe they are right. They started something. Come check it. It's not true. So there's a lot of false information, rumors that are easy to believe because they're playing on our fear.
Of course.
And once you catch a person with their fear,
They
you've
will-
got them.
You believe anything.
Yeah.
Absolutely.
Women need an excuse, and I tell you that, not to do a mammogram. I'm busy, I do not have time. It's painful, I don't want to pain. There is the radiation, they use it a lot, the radiation. I heard this, I heard that. Any excuse. Her neighbor told her the mammogram is painful. Did you try it? No. Her neighbor is right. Women come out of the mammogram and I tell them,
How was
it
it?
painful? It wasn't that bad. I was so afraid. I didn't feel anything. Am I normal? Did they do it right? I was like, yes, this is what a mammogram feels. Some women feel pain because they have a sensitive breast. For some reason, they are more sensitive. The majority of the women do not feel really anything. It's just some pressure. Yeah. If you've been through childbirth, if you've been through breastfeeding, mammogram are nothing. I felt the contractions during delivery. A mammogram is a piece of cake. It's nothing. Okay, come compress my breast every day, but
don't put me back in childbirth.
Exactly. Yeah. So please do not.
No, everyone is different. You're
different.
right. Everyone is different.
And don't believe other people's, their experience is different. And I want women out there to be responsible of what they're saying. I always tell them, how did the mammogram feel? Not so bad. Go and tell all your friends. Yeah. Go and tell everyone in your circle.
Yeah, don't stay quiet.
Because if you're 40, probably your whole circle is around this age. Go say, this is not so bad. Why did they make it look so bad? That's not true, okay? Don't, spread false information, false rumors, because you want to control women with their fears.
You have saved over 500 lives. Over.
Yeah, I hope so.
Inshallah,
and
of course.
not more.
If not more. What has been your proudest moment to date?
Saving this woman's life, because each woman is, as I said, is a valuable life. It's not a number. It's not a mammogram. And this is the responsibility that I have. Once I detect a small cancer, deep inside, I'm happy. I know this is going to be a bad news for her, but I say, I caught it. It's too small. I'm so happy I caught this. Yeah. This is going to be the worst moment for her, maybe. But I know that I saved her life.
And she's going to get through it.
Yeah.
Yeah.
So this is the proudest moment. When I detect a cancer that is 1 centimeter, even less, early things, and she removes them, and in a year she's healthy and she's got over it, these are my proudest moments, and the more I have, and they hate me because I will be the one bearing the bad news. But after a year, they come and they say, you know what? You saved my life. Yeah. And this is what is. Once she tells me that, I'm like, that's it. That's the proudest moment I can have. This is basically, career-wise, this is what I believe is. And this is what is the role of a physician, you know? And everyone is shifting, they're following more different outcomes. But this is our main outcome. We're saving people's lives. We're making it easier for them, treating their diseases, calming them down, decreasing their anxiety. This is what is supposed from a doctor to do.
With the good comes a little bit of bad.
Yeah.
On the flip side.
Risk, benefit.
Absolutely.
Everything you do. The makeup that I put on my face
For sure.
has some risk.
100%.
But the benefit, I look beautiful.
You do look very beautiful.
But this is how I think, And sometimes
Absolutely.
It is what it is. You cannot control everything.
Yeah.
And this is what we need to learn as a human beings. If it's out of your control, and this is what I teach my son. He overthinks, and I tell him, can you control it? He says, no. I said, stop thinking about it. He says, I can't. I told him, you will learn.
You will learn.
You will learn. Just
but on the flip side of the proudest moment, has there been a moment where it was quite devastating for you or heartbreaking career-wise?
Yeah, of course. There's a lot of cases where sometimes we miss early cancers, and it is one of these aggressive cancers that in 6 months it's like triple its size. And because there are some cancers that mimic benign findings, that mimic a cyst, for example. And this is one type of exceptions. So yes, it's devastating in these exceptions. Exceptions meaning young women who we do not expect to have cancer in. A finding that looks so benign that I dismissed. And it turned out after 6 months, she comes back and I'm like, it's a lump.
Yeah.
And I'm like, what did I do? Don't I mess up? Don't I do mistakes? Of course. These are devastating moments, but we learn from them. So now I'm like super aggressive of anything I see in the breast. And the patient tells me, do we need to biopsy?
Yes.
I biopsy everything.
Everything.
I do not want to assume. I've been through cases where I really cried that night because I felt I was responsible for this woman's life. I didn't do my job. Her whole life is affected because of me. I don't want that again. I don't want to experience that again. If it's not a cancer, you get reassurance. If it's something, I want to catch it in this early stage.
Can I ask, how do you deal with that? It's a huge responsibility to shoulder as a person who is literally, you've got their lives in your hands.
Yeah.
I mean, even listening to you makes me slightly emotional.
Yeah, I know. It's very emotional. I was very emotional when I started. There was a lot of responsibility. It used to cripple me. And then I was sitting with one of my older colleagues who've been there for a couple of years, and I told him, like, how do you deal with it? Maybe you missed something. Maybe
because you're a human being.
And
you're
we
not
do
a
errors.
robot. Yeah.
I do errors, and I told you, I might miss cancers. I'm not perfect. I do not detect all cancers. And that's why, while I'm talking to patients, I tell them, you know what, there might be something I haven't seen. Yeah. And they're like, shocked, really?
What do you mean?
I tell them, I don't see anything, but if there's anything that I have missed, please do come back in a year.
Yeah.
Get checked. If you feel anything, come back. And this way, I make them responsible also for their lives, that I'm not perfect. I might miss something. This is, I might be tired today. I might be distracted. I might be answering, my kid might be sick.
I'm not school or something. You have a life.
You have to know that doctors are human beings. They might do errors, unintentionally, of course, because we don't want to defend doctors who sometimes do an error intentionally. We are human beings. We have a lot of things to help us. The AI now is helping us in flagging things that I might miss. So we have things that helps us, softwares, AI. It makes me look at a part of the mammogram I have missed, but we still miss things. And I say it in my report, and I always mention it, 10% chance of a false negative. What does that mean? That there might be things that we miss. There's a lot of challenges. And so how did I overcome this, that it's a big responsibility? I told my older colleague, I was like, really, this is a very challenging breast. I might have missed a cancer. And he looked at me and he told me, you are doing your best. You are doing your best. This is more than enough. You see, doing this and thinking about this means that you care and you're doing your best. At least you're doing your best. Do not doubt yourself. Just do what you can do, the best that you can do, and this is where things end. You might do mistakes. Even with your best, you might miss. You might do mistakes. You might do something wrong. So just give yourself the credit that you're doing what you can do, and this is what we need to know. In every job, there is a certain limit, and this is as much as you can do.
It's so true, and that's the thing. Like you put yourself 100% out
Even
there.
as a mother.
Yeah.
Don't you doubt yourself. Don't you think the responsibility of a mother is bigger than the responsibility of me catching cancers? 100%. It is bigger. So how do I deal with it also? I do my best. Yeah. Sometimes my best might be, I might not be able to cook every day. My best might be not doing that homework every day, not being there in specific situations where I should be there for them. This is my best.
This is your life. It's life. You're part and parcel as a woman, a mother, a doctor, a wife, a sister, a daughter. You aren't one-dimensional.
We should stop making this perfectionism is not there. No. And with the social media, you see, and I always, I show the best parts of myself on social media, and they ask me, how can you do it? You're successful as a doctor, as a mother. You know what? I give them an example. Yesterday, I was supposed to pick up my children I have a lunch break, and on Friday, I make sure I go pick them up.
Because they finish early.
Yeah. And yesterday, I was not able to do it. I had a workshop, and I was busy. I sent the driver with my helper, and my son called me. He literally was shouting on me. He was crying and
Why didn't you pick me up?
Why didn't you pick me up? This is the worst day. I needed you on that day. I needed you as a mother next to me. Mommy, I really cannot forgive you. And I tried to calm him down. I shut the phone. Yeah. I was about to cry, and then I told him, Marvin, this is the best that I can do on this day. You have to accept that. I cannot be there for you every day. Did I feel guilty? No. Did I cry about it? No. It felt like a knife in my heart, of course, but I said, you know what? I'm doing what is good for me today. This is the best I can give him today. Tomorrow, I might sit with him 24/7, read all the books, anything that he wants. But today, this is what I can do.
Absolutely.
So stop beating yourself up. You are not perfect. You cannot be a perfect mother. I cannot be a perfect doctor. I cannot be a perfect wife. I cannot be a perfect cook. Stop using this perfectionist role for women. It is not true. We do not look like this every day. You should see me in the morning with no makeup.
You should have seen me 2 hours ago. Look very different to this right now.
And this is where I said, my son saw me leaving the house like, Mommy, you look so tall
beautiful.
and beautiful. Your hair is nice. So there is reality out there that we cannot dismiss. We cannot be perfect in our roles, especially as mothers, doctors. Just believe it. This is reality, you know. Don't beat yourself up. I see a lot of women really beating themselves up. You know, they have to have the best, tastiest food. And I tell my husband, this is what I know how to cook. You like it, eat it.
If not, let's order.
Exactly.
Khalas.
Yeah.
Yeah, I know.
So yeah, that's it. Don't beat yourself up. Even, you know, one time I spoke about this subject, like, as a woman, do we really have to be the ones who cook in the house? No.
No.
No. No, I went through a lot of phases in my life. I was in Manhattan on my own with a child and my husband doing a fellowship training. I worked from 7 till 7. I don't have time to cook. Other women would beat themselves up. When they come, they cook, or they wake up earlier. You can do it, but it is not sustainable. So my husband learned how to cook, and now he's like a perfect chef.
Excellent. Excellent.
And I'm like, I try to help, but
he's like, stay out of my way.
Has, you know, each one, you're good at things. Make sure you improve these skills. You know, if you're not the best cook, do what you can do, but do not kill yourself just so that you get the tag of best mom to go to the kitchen when you're tired and you don't even like it. There's alternatives. I'm not saying don't feed your children.
No, I know what you're saying.
Don't go to the grocery.
Just be kind to yourself to understand what you're feeling that day.
You know who should be kind to us too? Other women. Because other women make you feel bad that you're not a good mother, you don't cook, really.
It's not even so much direct. It's indirect, right? It's indirect where you see it on social media, where you've got people that are making things from scratch. And you think to yourself,
there's no way I can do this.
There's no way I can do
from scratch.
But then also on the same time, you know, let's say we're talking about you're out there saving lives. Baking sourdough at home may not be your priority on that day. You know what I mean?
Do your best on that day. I might have a Sunday, I have nothing.
Exactly.
You do, and do this from scratch thing.
And that's the thing. And I think with everything in life, not just mother, every aspect of your life, to do your best is the only way to live.
And don't compare yourself to
100%,
others. Really,
which
don't
is really
compare
hard
yourself
in this day
to
and age.
others, because social media is making it look like everything is easy, beautiful, skin, life. And I see a lot. And I continue the reel of these women who are living this luxury life, 6 a.m., ice bath.
Oh yes,
and
with
like,
with the skincare, and they
I
look
watch
so
it
great.
Till the end, and
me
I say,
too.
And I like it, but it's not reality. Okay, so shift more.
It's not reality.
And I try to go into more things, and this is important. In your social media reels, try to scroll things that will make you feel bad about yourself. You know, anything like this luxury lifestyle. It doesn't make me feel good. What is it doing? Nothing. It makes me feel bad about even the luxurious life that I have. It makes it look bad. So why do I want it? Scroll away from it.
Scroll away.
Don't let the pattern of reels come where you have all these, beautiful women out there, beautiful body, beautiful kids, perfect life. No, go into more real things, okay? So this is an important also...
really good point.
It's a tip. Don't go, because I see the reels of some of my friends who are like, wow, look at this car. Her husband, she doesn't work. Her husband is a millionaire. That's not real.
No.
It's just, it makes you feel good?
Yeah.
No, it makes you feel bad. Just scroll
away. Scroll away. If there's one thing, one major piece of advice to the woman who's listening today, sort of to close up an hour and a half of your time.
Yeah, it is. What I go by is just let it go.
Let it go.
Let it go. And if it's not in your control, let it go. If it's not something you can change, let it go. Because a lot of women always have this idea that their partner, they can change them also. It's not worth it. If it's not if you're putting too much energy and power into something that is not going to change, let it go. Cancer, whether you can have it or not, it's not in your control, let it go. Try to really like scroll away these thoughts that are bad, and just take it day by day. Do your best on that day. Don't overthink about things that are out of your control. And this is our only, I think, error as human beings. We overthink, we think about bad things, and we overthink things that we cannot control. So really, just try to be your best in that moment. Try to live in the moment. And it's very hard, but I've learned it the hard way. I do not plan things that are, months away, worry about things that are months away. I might not survive maybe another week. You never know what happens. Life is mysterious.
You're not guaranteed your time.
I worry about having breast cancer when I might not have it all in all, So worry about the moment today. If you cannot control it, just really let it go. It's easier said than done, but it's small practices that you do every day that will let you reach this ultimate, because a lot of people tell me, are you on any medication? You're so calm. I have like a stressful...
With 2 little boys.
I'm like, too calm. I'm too calm. It's like, what's going to happen? Let them mess it. Let them mess it.
What is going to happen?
They look at my kids. They're
so
fighting.
What? Yeah.
They're fighting. The car is all crumbles of food. So what? I can clean it. Everything that can be cleaned, money can solve it, detergent can remove it. I really don't care. As long as they're happy, healthy. I'm happy. I'm healthy. And I don't believe anyone is because they ask me, are you happy? No one is happy. We all have our problems. Don't believe it that we're all like, we have a perfect life. But I believe if you have health, then you should be happy.
Absolutely.
Because once you lose it, everything else becomes secondary.
My husband always says it's the invisible crown you wear to have health.
Believe me, because sometimes, you get a flu and it's so hard and you sit in bed 3 days and you cannot do anything.
No.
So you feel how vulnerable you are.
Yeah.
Let's stay humble.
Absolutely.
This is what we need to stay humble. You're a human being, okay? And do not think why a disease will happen to me. Just change the mindset. Why not me? Let me work on why not me. And if it happens, then I'm ready. Because when you say, why me? You get so shocked. Why did it happen to me? No, it might happen. If it happens, I will overcome it.
Absolutely.
Don't anticipate also things. So there's a lot of negativity that our brain is so good at. I really don't know why we are like this.
I think we are default negative.
Yeah. We are default negative. And that's why we have to reprogram ourselves.
Yeah.
Small things. You will get there.
Dr. Tatiana, I don't know how to thank you for your time.
No, thank you.
This was just, again, so hopeful and informative. And we're going into October where Breast Cancer Month is all about the awareness. And you bring such a human aspect to something that people generally always want to avoid talking about.
Yeah, especially October. Women hate it. We do all this
hate
pink,
it. And it's...
all awareness.
Yeah.
I get women who tell me it makes me more anxious.
It is anxiety driven.
If it makes you anxious, act upon it, okay? Have you done your mammogram ultrasound?
I think that's the
Are you anxious?
overarching.
Why you're anxious? Because you're afraid of breast cancer. Did you do your mammogram ultrasound? No? Okay, so of course you're going to be anxious. Have you done them and they're negative? You will feel so reassured and this will not cause this much fear. But of course, we cannot forget there's a lot of women who have bad experiences with breast cancer. They've seen a loved one lose their life. So I understand. It is not
easy.
Pink, butterfly, roses the way we depict it. But we're trying to make it hopeful. We're trying to make it look good because it doesn't look good. So let's just keep the hope in everything,
Thank you so much.
Thank you.
Thank you for being here. I appreciate it.
Thank you for giving me this chance to talk about these important things for women.
It was an absolute pleasure, and I think the value you've given the woman who's watching and who's listening, and all of your patients. It's actually the most incredible thing that you're doing, and I think that the entire community is honestly very appreciative. I think I can speak for myself. I really need to book in a mammogram. I think that's what I need to do from this.
I'll help you with that. Don't worry.
I turned
sometimes
40 in July.
The process of booking it makes you also not do it.
This is it. I don't even know where to start. Okay, I'll just call.
I'll help you. So a lot of women tell me, I want to book a mammogram. No, just give me your number. I'll let them call you. I'll let them chase you.
That would be great. That would be great.
You will not do it. Because if you call one time, they don't answer. Second time,
I'll call next. Khalas, it's not meant to be.
It's another month. It's a month. So month go by and you didn't book it just because of the, the process of booking.
I know.
Yeah, don't worry about it.
I'll put it in your hands.
Yeah.
Another responsibility to add to your plate.
No, it's fine.
Thank you so much, Dr.
Thank
Tatiana.
you. Thank you for this.